This is Al.
And he is 4 years old.
At 1 year old, Al reached many gross motor skill milestones at normal times, such as holding his head up, rolling over, sitting, and standing. However, he did not walk until 16 months, which normal walking age is between 9 to 12 months. By age 2, he started to assume a lordotic posture while standing, but at age 4, he is experiencing Gower signs and Trendelenburg gait. Gower sign is when you use your hands and arms to get up from a squatting position because of a lack of hip and thigh movement. Trendelenburg gait is also known as waddling gait. It is when you waddle to one side when you walk. He has 2 other siblings. His younger sister is in good health, but his older brother is in a wheelchair with similar problems. We performed a biopsy of his right gastrocnemius muscle. There were 3 major microscopic changes in his muscle tissue. The first showed the degenerating of skeletal muscle fibers. The second showed numerous macrophages in that area. Macrophages' job is to clear the cellular debris and damaged muscle cells. The third showed muscle fibers breaking down. While muscle fibers were breaking down, other fibers appeared more dense or dark in color. This is what causes excessive contraction, which is when there is more overlap between actin and myosin. These histopathologic changes led us to believe that Al has Duchenne muscular dystrophy, the most common type of muscular dystrophy. Because of this, we believe his enlarged calf muscles is due to another disease called pseudohypertrophy. This also led us to believe that he is developing scoliosis, which is abnormal lateral curvature of the spine. Duchenne's muscular dystrophy is an X-linked recessive genetic disease. This means that it is passed from mother to son on the X chromosome. The location of the genetic defect is always at the XP21 site on the X chromosome. This part of the human genome encodes for a protein called dystrophin. A deficiency of dystrophin results in functional abnormalities in stretch-activated cation channels, allowing an influx of calcium ions onto muscle cells, causing the activation of cell necrosis.
For treatment, we referred Al to an occupational therapist and a physical therapist.
Occupational therapists can utilize certain techniques to help Al be as independent as possible in self-care activities. They provided him with a power wheelchair with standard joystick, chest straps to help with his scoliosis, and slings and other movable arm support to continue to allow Al to eat, write, and read independently. Physical therapists provide many of the same therapeutic measures as occupational therapists, but range of motion maneuvers and consistent walking can delay the loss of ambulation. Swimming and breathing exercises will improve respiratory function, but excessive exercise can accelerate the degenerative process of the muscle. We will also have Al take calcium, which will provide a raw material to lay down bone extracellular matrix, and fluoride supplements to stimulate the bone building activity of osteoblasts.